My name is Liddy Barger. I use she, her pronouns. I'm the Director of Housing Initiatives at Human Services Coalition. We are the lead agency or the collaborative applicant for the continuum of care. We are here to talk about actually two funding opportunities that are open right now through the continuum of care. One of which is the annual notice of funding opportunity from HUD. We're going to do sort of a brief overview. We have not traditionally done the funders presentation about this opportunity, but we did change the application process this year and wanted to give people, if they wanted one, an opportunity to come and hear more about the newer process and be able to ask questions and find out stuff. So we will, so the presentation is set up first to talk a little bit about the NOFO, and then we're going to talk a little bit in the second part about the opportunity for a housing specialist position. And we can just get started. Great. Looks great. We are here to talk about the 2023 Continuum of Care Program Competition. We are New York 510. Next slide, please. Simone and I are the staff of New York 510, I guess I should say. So the mission of our continuum, or what is a continuum of care? I think, most people in this room know what a continuum of care is. I'm going to go fast through these slides, but we are a few things, right? A cross-sector planning network of private, nonprofit and government partners who are all working together with the mission of making homelessness rare, brief, and one-time here in Tompkins County. To do this, we organize a community-wide effort to prevent and end homelessness. This looks like our continuum of care meetings, our homeless and housing task force, some of those bigger planning meetings that we do, along with our committees. We provide funding and support to not-for-profit agencies that are working to support the mission of making homelessness rare, brief, and one time in Tompkins County. So that's what this funding competition is part of. There are some other ways that we work to provide funding and support, but the continuum of care is obviously sort of the root of our mechanism for funding permanent supportive housing and other projects. And we also work to promote access to supportive services and housing. This is a lot of Simone's work and what we do with coordinated entry here. So we work, you all know coordinated entry. I'm not going to get too far in the weeds with it, but we do coordinated entry, and we also work to promote access to mainstream benefits for folks who are experiencing homelessness. So things like SNAP benefits, temporary housing assistance, things like that. Next slide, please. So what is the opportunity? We are a very small continuum of care. We are a single county continuum of care, which makes us a little different than some of our neighbors across the country. There is a continuum. Every community in the United States is part of a continuum of care, and they all look a little different. One of the things that makes us unusual is our small size. So this is the amount of our opportunity this year. So we have $203,109 available in renewal funds for continuum of care projects. Things that were funded in prior years include Tompkins Community Actions, Chartwell House, Magnolia House, Amici House, St. John's Community Services has a small permanent supportive housing project, and then we also have an HMIS grant. There's $80,000.77 available in what we call bonus funds. Bonus funds are a way to get new projects into our system, but essentially require our full continuum of care to score well in the collaborative application, which is what continuum of care staff and others are doing in the background as the local competition is happening. We're working to complete a very robust application of funding that talks about many things and our system performance and tons of data, things like that. So if we do well in our collaborative application, that sort of opens the opportunity to bring in some of those bonus funds. The other way that new projects are created through this opportunity is through reallocation. And we have a lot of information about our reallocation process on our website. I'm going to probably continually redirect people there because it's all set up for you in a tab. You can read all the details of all of these things. This year, our domestic violence bonus totals $57,543. That's for a project with there's a couple eligible uses of that DV bonus funding, and it is required to serve folks who are homeless and experiencing domestic violence. So then this year is the first year we have had this YHDP funding. So this is year 2 of our youth homelessness demonstration project adventure. So that amount that you see there, $860,765, is the amount of our YHDP renewals. This is year 2 of a 2-year grant cycle that those projects are in. And it is a non-competitive year for them. So those projects will be submitting some information and data and involved in our process, but those renewals are non-competitive, which means that we will not be reallocating or creating new projects with that YHDP funding in this competition year. Next slide, please. This is continuum of care funds are only going to projects that are serving people who are going to meet these definitions of homelessness and have some service needs and or a disability. So the definition of homelessness, this is the literal homeless definition: living in a place not meant for human habitation or in an emergency shelter or transitional housing. And then category 4 actually has had a recent change in this notice of funding opportunity, or actually in the last year or so, the definition changed slightly. It's a lot of words. I'm going to let you read them. It is important so that especially if people are thinking about any of those DV bonus funds. We're going to send out these slides in a recording as well if you want to refer back to the new definition of category 4 homelessness. Those words that are highlighted in red highlight the changes. Next slide. These are the types of projects that are eligible for continuum of care funds. So those CoC bonus funds are the top group of things listed there. So you could apply for permanent supportive housing, rapid rehousing projects, joint transitional housing and rapid rehousing projects. I can share some information about what that looks like. We don't currently have any examples of that project type in our system. The HMIS lead agency can apply for a dedicated HMIS project. Our HMIS lead agency is New York 5. We're in a collaborative with New York 505. They're in Syracuse. And then for DV bonus eligible projects, there are 3 project types. So rapid rehousing, that joint transitional and rapid rehousing project type, and then support services only for coordinated entry project. Next slide. So what is the competition? So we are already sort of in the competition. We have sent out multiple announcements. We've shared our RFP a bunch of times. So we're in it now. So the RFP is out. Project applications are submitted. The application due date for our local application this year is August 21st. They will be reviewed and ranked by our Continuum of Care System Evaluation and Ranking Committee. I can give you more information about who those folks are if you're interested. People will be notified. We have a specific date by which you'll be notified that we'll tell you about later. All in the background, in the meanwhile, the Continuum of Care is writing this collaborative application. You actually, if you are a CoC agency, may be getting some requests for information or details from me and or Simone in the next couple of weeks as we're working on our application. After the projects are ranked, they're submitted in a priority listing, which becomes part of our collaborative application for funding. Next slide, please. We are here somewhere between July 21st and August 21st. August 21st, as I mentioned, is that application deadline for local applications. You'll submit those right to me. My email is there, and we'll send them out to our ranking review committee. Projects will be notified of their acceptance or rejection or ranking on or before September 12th. And at that time, between that time and September 21st, projects that were approved for funding will be expected to complete and submit their application in eSnaps. So eSnaps is another thing that we could talk for many long minutes about. But I think the best thing for me to do is to direct you right to their website, or we have it connected to our competition site on our website. If you are unfamiliar with eSnaps and are thinking about applying for a project, it's worth familiarizing yourself now. It's fairly technical, it's fairly time consuming. It's not the most intuitive software. And the application itself that those approved projects will be submitting is different than our local RFP questions. So you are answering a slightly different set of questions. Then September 28th is the deadline for the collaborative application. We'll submit it to HUD, and then we wait to hear from HUD about the outcomes of our projects. Next slide. So these are the stated HUD's stated priorities in the NOFO this year. These are pretty much in line with what their priorities have been for the past few years. People who are interested in learning more about the way that HUD sets their priorities or how these priorities could look in a community, I'd love to talk to about another time. I did just want to take the time to sort of share out where HUD's funding priorities are this year for the continuum of care funding competition. So obviously their priority is to end homelessness for all persons. Another very strong priority of HUD is to be sure that projects that they are funding with their dollars through continuum of care are having integrity towards a housing first approach. So housing first, I think most people in this room are familiar with. Happy to talk to you more about it, but this year in the NOFO, we are being asked to dive in more to talking about the ways that our projects are having integrity to that housing first approach. So it's a big deal in this year's NOFO. That they have another priority to reduce unsheltered homelessness, improve system performance. That's an area that our community, like real talk, has some work to do. And we'll continue doing that work. That has to do with our HMIS data and our outcomes, our length of stay, how many times, how are people returning to shelter, all of those system performance things. This year, for new projects, there's an opportunity for additional points for new projects that are partnering with, that are leveraging housing resources or health resources. This is another thing that is very cool, very interesting, a little bit complicated, and I'd be happy to send specific resources about how to demonstrate those partnerships, what a partnership would look like in the context of this competition. Advancing racial equity is an explicitly stated priority of HUD in this NOFO, and they are asking a lot of questions about how we're doing that in our community. Improving assistance to LGBTQ+ individuals. This priority 8 is one that they have definitely sort of turned up the volume on this year in the notice of funding opportunity, and that's engaging people with lived experiences of homelessness in the planning and implementation of our projects, and fully integrating them into our continuum of care. So this year in the collaborative application that the CoC staff are preparing, there is a request for a letter of support from our people with lived experience. It's just this has been given a higher platform than it has in prior years. I think it's super cool and important. And then the other priority of HUD is always to increase the supply of affordable housing in our community. Some other things that we're asked to talk about in our collaborative application, which is posted and public and able to be read by anyone, are things like, how are we preventing the criminalization of homelessness in our community? How are we engaging policymakers around the supply of affordable housing? How are we partnering with early childhood education? And sort of the collaborative application seeks to find out how is the whole system working together to promote these priorities. That it's always very interesting. You can actually learn a lot reading the HUD NOFO about what the federal government's sort of priorities and leanings are as far as funding right now. And then if you're ever, so something that I have done in the past, if I'm trying to learn about another community system, I actually go and look at their community's collaborative application, because I can learn a lot about how a community's working together around in their homeless response system. So you can learn a lot in this application. Next slide. Oh, this is where Simone begins.
Sure, yeah. Hi, my name is Simone Gatson. I use they, them pronouns. I also staff the continuum of care in New York 510 in Hopkins. And I'm just going to walk us all a little bit through the new application, because it is kind of a new format this year. We do have both the applications and the rubrics for how those applications are going to be scored on our website. So those are available to folks. They're also linked into our We Can Review process and everything. So like Liddy said, the website is a really great resource. That's where we're putting pretty much everything that we're sending out this year. So I do recommend to kind of take a look at that if you want to dig into more of the stuff I'm going to show here. This is what our application looks like. It has this nice little picture at the top. And here we go. Wait, there we go. Okay. So it'll start off with some narrative questions. So what you'll notice about our application is that really a lot of those priorities that HUD has established in this year's Notice of Funding Opportunity are reflected in this application. So we first start off with community needs. So how does the project support the continuum of care's goals of ending chronic youth, family, or homelessness for all persons? So that is really going to see, have you looked at the homeless and housing needs assessment that was published in 2022 that we commissioned from Horn Research? Have you looked at, have you requested other kinds of data from us? Have you looked at the Home Together Tompkins plan that was published in the last year? Are you referring to that in terms of how you are identifying the need for your project in our continuum? So that's kind of what that question is getting at, and how is that integrated into the format of your project and your plan for implementation. The next is capacity. So just checking in to make sure the agency has the capacity to support the housing project that they are applying for. That one's pretty straightforward. Project implementation, so kind of your plan for implementing the program. I will also say that this is the application for new projects. It looks slightly different for renewal projects. So for renewal projects, the focus is really on how well the project performed in the previous year, whereas the new projects are really going to focus more on these narrative questions about what your plan is for implementation and how that reflects those priorities that were listed before. So I'll continue going through this. But some other priorities are person-centered planning. So how will your program support and engage the individuals served? Racial equity. So how does your project work to eliminate racial disparities in housing outcomes? Again, if you need any data or information about our community to kind of support your project application, please do just reach out. We're happy to share the data that we have that has not been necessarily posted in other places. So just feel free to reach out if you need any data, especially surrounding racial equity. Then there's elevating lived experience. So how does your program plan to elevate the voices of and employ people with lived experience of homelessness to create better support for your clients? There's some examples of actionable practices listed there. So we really want to see some of those integrated into the plan for implementation of the project itself. Serving intersectional identity, so how the program will provide consistent help across intersectional identity. So obviously there's the racial equity question, but in this question, we're also talking about LGBTQIA+ folks, youth, disabled people, really those people also that have either specialized service needs or severe service needs in our continuum. We want to know how your project will plan to serve people with those intersectional identities. Housing first and trauma-informed care. So again, that priority of serving people with a housing first model, it is the best practice nationally for ending homelessness. So you'll describe your program's commitment to a housing first model as well as trauma-informed care to create the safe and stable housing environment for people who are exiting an experience of homelessness. You also want to attach any policies and procedures that demonstrate or support this commitment. So that would kind of help to support this housing first philosophy. So really what we would be looking at is, what do intake papers look like? Are you requiring a ton of documentation for people to be able to access your project? Are you requiring things like sobriety, a diagnosis, things like that? Because those might not necessarily be aligned with this like housing first idea of really trying to serve people with housing before having them meet some other kind of lower priority needs, or like resolving those lower priority issues in their lives before they enter your housing project, right? So again, I think Lee mentioned, if you all have any questions about housing first, we would be happy to provide some documentation as well as the checklist that we're using in this year's NOFO to assess some of our existing projects and their incorporation of a housing first philosophy and plan. But yeah, that's that question. Connection to healthcare services. So your strategy to ensure clients are connected with and have ongoing access to appropriate healthcare services, including mental health care and gender affirming healthcare. So this could look like an MOU with a healthcare serving agency, or just a description of your plan or specific agencies you plan to engage to make sure your clients are engaged with appropriate healthcare services. And then there's performance measures. So kind of how will you achieve these performance measures with your project that you're applying for? So measures related to employment and income growth. So how clients will be assisted in obtaining employment, income, and mainstream health resources. In this one, we want to see your ability and commitment to help those clients, but also, specifically named workforce development agencies or programs. So making sure that not only do you have a plan, but you do have agencies in mind to kind of collaborate with who are specifically engaging people surrounding employment and income growth. Housing placement and retention. So how will you help participants to obtain housing quickly, but also help them to maintain that housing and like in the long term. So making sure they're not returning to homelessness after project entry. And then finally, returns to homelessness. So that's returns to homelessness, right? Making sure that clients will not return to homelessness after they exit your project. So both helping them get into your project quickly, helping them maintain their status in your project, but also making sure that they're not returning to homelessness after exiting your project. So those are really what we're getting at in terms of project performance. The rest of it really is this narrative kind of, how does your overall plan for implementation support some of those priorities of the NOFO? There are some special project questions. So if you have any of these special project types, you will have this opportunity to get additional points. So first, there's domestic violence bonus applicants have special questions. So just kind of describing your agency's experience with working with victims and survivors of domestic violence and whether your organization is a victim service provider. For coordinated entry applicants, there are some associated questions about coordinated entry and how your project is going to help supplement or assist with coordinated entry in our system. So for those folks that are applying for supportive services only coordinated entry projects, you would need to fill out this section of the application as well. For healthcare project applicants, so this is any project that has created a partnership with a healthcare provider to provide services in their project. You'd want to fill out this section. And then you would have to attach a commitment letter from that healthcare organization that's going to commit to serving folks in your project. And then subsidized partnership project applications. So so this is if you are supplementing your project with an additional funding source, then you would fill out these questions here. But feel free to ask any questions that you have. You would also attach a commitment letter to this question as well. Then there's budget questions. So you'll attach a budget and also any documentation of match funding that you're using for your project application. And you'll also get points for cost effectiveness. So we'll be kind of comparing the cost per bed to the cost per bed for other averages, community averages for the cost per bed of other programs that are similar in our community. And those are described right there. And you can see what the point allocations are for those different costs. So like I said, that's the new application. The renewal application is a little bit different, but I did just want to compare the scoring for a brief moment. So obviously for the new project application, you get about 45 points for that narrative questions section, 30 points for the performance measures, 20 points for the budget questions, and then an additional 10 points if you are a special project and you fill out that bonus section. So the total number of points you can get is 95. If you're a special project, that's 105 points. And then for renewal applications, because the bulk of that application really is how the project has performed in the previous year, it's a lot easier to lose points based on past like literal performance that we're pulling out of HMIS than it is to lose points based on kind of a narrative or your plan for how you're going to implement something. So we did want to add an additional 20 points for successful past performance of renewal projects, just to kind of even out some of the advantage that someone who's describing how they would ideally implement a project might score a little bit higher as opposed to someone who's actively implementing a project, right? So yeah, if you all have any questions, I'm not going to go through the whole renewal application. A lot of the narrative questions are actually very similar. And the project competition report section itself will actually be pulled from data from our homeless management information system that previously funded projects already kind of have to participate in because they're receiving CoC funding. So great. This is ultimately kind of what everything breaks down into, and I'm not going to go totally into everything that's here, but this is how the funding broke down from last year. So Liddy mentioned this idea of a priority listing, right? So this is what we submit to HUD. Ultimately, we'll take those scores, we will put those scores here, and the person with the highest score will go up to the highest priority, and the person with the lowest score will be at the lowest, and we'll list them all that way. And then there's basically this breaking out of tiers. So for tier 1, that's kind of the funding that we are pretty sure we're going to get as a CoC. And those are going to be the applications that are going to be prioritized to be fully funded, right, in that order. Tier 2 is if we do a really good job submitting our collaborative application as a CoC, we can get some of those bonus funds to fund additional projects. So that's why the priority application matters. And that's what the whole rank and review process kind of boils down to, is getting these scores for us to say to HUD, okay, if you only give us this amount of money, this is really what we want to prioritize funding fully. This is what we want to prioritize funding partially. And if we do really great and you give us some extra money, this is what we want to fund. So that's kind of what this all breaks down into. And it looks a lot more complicated than it is. But again, if you have any questions about it, let us know. The DV bonus funding is kind of in its own category, right? So that funding is really only available to projects that are looking to serve people who meet that category 4 definition of homelessness, and is funding that we haven't yet been able to integrate into our CoC. But if folks are applying for that, that is kind of separate from this tiering process where, I mean, it's kind of just on the table for whoever wants to apply for it. So I'm definitely happy to answer any questions about that, but just know that that DV bonus funding is a little bit separate from what I just described.